came into the office to visit me as an athlete and an athlete with an injury, approximately 3 or 4 months ago. He's a very avid runner, very competitive runner who had a problem and was really worried about not being able to compete at the level he wanted. And his symptoms were very specific to the area behind his ankle, which is the Achilles tendon area. The pain was only related to his running and did not have pain at rest, and he had very, very classic symptoms of Achilles tendonitis. And in terms of treating the runner, I've had many of these injuries, especially of the foot and ankle, so it's very, I can identify with the injury and the treatment that we would institute. Adam is an elite runner. His goals are to run long and fast, and he did not want to be tied down by an injury that he had never had in the past and was really not familiar with. And my goal as his treating physician and with the assistance of being a runner myself was to identify the injury and get him back to the level of running he wanted to attain in order to meet his goals. Our diagnostic workup for Adam really included x-rays and a very, very complete physical exam. I perform a very specific physical exam related to the injury. We look at other parts of the body, but specifically we focus on that body part. And with Adam, it was very, very straightforward in terms of what his injury was and the diagnosis. Sometimes we will use X-ray or MR imaging or a CT scan if necessary to support the history and physical exam. But I believe in Adam's particular diagnosis, we did not have to use that. So our treatment included a well-supervised, well-balanced physical therapy program to regain some flexibility and strength in his calf muscles and his foot muscles and the muscles of his foot and ankle. We also had we worked on specific shoe wear. We worked on orthotic management to help to alleviate his discomfort while he was returning to his running. And we modified his running pattern a little bit over the next 6 or 8 weeks of his treatment so that he could still run, but would be able to heal at the same time. So Adam is a very intense runner, and we had to have a very good heart-to-heart talk about that. But I had to convince Adam that cutting back on his running was not going to make him any less of a runner in terms of his performance and what his goals were. His specific goal was to run the Boston Marathon and run it as well as he could. And I explained to Adam if we could modify his running during the early training of his marathon training, he would be able to get back in spades in terms of performance on the day of his marathon running, the actual event. So there's a little bit of discussion and for Adam to buy into that process, being an athlete that was always a runner and never worried about the intensity and how it would affect an injury. So once an athlete gets an injury, you have to build their confidence and reassure them that the healing process is well defined if they follow the rules and they get on and they will heal predictably. And that is my job, is to build that confidence in Adam and all the athletes I treat. When a runner has a little pain, we tell them to keep an eye on it for a day or two, no more than a week, depending on the severity of the pain. But when a pain lingers, it's time to be seen. And Adam was seen fairly quickly after the pain began, and we were able to intervene. And there is no question that early intervention does speed the healing process.